Hi all, how are you? I'll wait till it gets connected with you guys. I hope you all are doing good. Hi doctor. Let me just wait for a few people to join and then I'll connect you. Okay. So so today's session is very special when we are talking about pain and in MS, and we can see that pain is the most common symptom of MS. Up to two-thirds of people with MS report about pain in the worldwide studies, and those who experience pain find it that it affects their daily lives. How difficult it is to manage those kinds of pains in your body and manage your MS with the pain. Well, I'm no specialist in this, so I have to, of course, invite the special guest today. His name is Dr. Anthony, and he will let us know everything about MS and pain management. And he is based at Florida, and he specializes in pain, and he can tell us that what kind of pains affect MS patients, how to manage each and every different kind of pains in MS. So let me connect with the doctor. Send a request, doctor, if you can just accept it. Hi, doctor.
Hey, how you doing?
I'm good. How are you? It's such a pleasure seeing you.
Thank you. Thank you very much for having me. I hope I can help you guys out here a little bit.
I'm
Using my
sure.
rehab background and my pain background, I've taken care of MS patients on both sides of things. One's when we're diagnosing and when we're first getting into it, and then also when they start to have some pain. So hopefully I can
Okay.
help you out. I hope you have some good questions and the audience has some good questions and I can point you in the right direction.
I'm sure they all have a list of questions, and I hope we are able to
Yes.
cover them all. So,
Yeah.
yeah, firstly, thank you very much for taking out time to be here. And we do have such sessions, and people are really excited, to have such sessions and have doctors on board, special
Yeah,
doctors
no,
like
this is
you.
great. This is a great way to get across to patients too. I think it's an excellent use of technology.
Thank you so much. So, Doctor, since you said that you have seen MS patients and they also suffer with different kinds of pains, can you let us know what kind of pain symptoms do they tell you about? The most common
I
pain that they have.
Most common pain, it depends on their progression of where they are with their MS. If they're just starting off, it's more just numbness and tingling, and it's very
Yes.
hard to really diagnose MS in the early goings. It's one of those things where it's kind of in the back of my mind. I was like, could this be MS? It's the right, type of person. They've had a history, family history maybe of it, or they are the right age, females more than males, obviously. So it's one of those things that's always in the back of your mind. But when you first hear someone come in and say, hey, I have some weird numbness and tingling in my left hand and in my right foot, it's not the first thing you think of. But that's definitely the first complaint we hear from patients that are just getting diagnosed. Um, as you move through the disease progression, I think the pain starts to ramp up a little bit. Luckily, some people don't suffer from pain,
Yeah.
but the pains we usually see are secondary to this inflammatory nature of the disease. The
Right.
nerves are getting inflamed. It's an autoimmune disease. We're attacking these nerves, and nerves don't like to be inflamed. We know that.
Right.
Any inflammation process of the nerves is bad. So a lot of times we'll start seeing a lot of nervy pain, we call it, right? Where
Hmm.
it's burning deep, like a deep
Yes.
toothing, in your leg or in your chest, the MS hug we kind of
MS hug.
always
Yes.
always talk about, which is probably the worst pain you can have in MS.
Oh, yes.
It's a lot of deep nerve pain is what I call it. And patients aren't able to pinpoint. They can't say, oh, my knee hurts, or
Oh,
oh, my back hurts.
yeah.
It's more of a vague generalization of what their pain is, but it's unnerving, for lack of a better word, because it doesn't go away. It just kind of deep ache that keeps going on. So
Yeah.
that's what I'd say. It's all this nerve pain. It starts with numbness and tingling. It doesn't start. It's not just one day. Hey, you have this severe pain. It starts with numbness and tingling.
Right.
Then, as you progress, you get this deep nerve pain. Then, what we see even more in our spine clinic too is when you're starting to have trouble ambulating or trouble walking, you start developing these other joint pains. And I don't think people realize that.
Hmm.
You get hip arthritis quicker
Oh,
if you're using a walker or using crutches. And then you
yes.
can develop lower back pain too. So I'd say that's further down the road, you start breaking down your bones and muscles a little bit quicker because your nerves aren't controlling those muscles as well. So I'd say it's a whole progression of numbness, tingling, deep
Yeah.
nerve pain, then we start getting some joint pain, that nerve pain.
Doctor, when you talk about the spine pain, is it possible that 90% of people actually complain of spine pain in MS? Because I can see many
Yeah,
people do.
so it's weird. You know, some of the studies say, well, spine pain doesn't come from MS.
Yes.
I don't, maybe not directly. There's, you know, the inflammation process on the spine. But to
Right.
me, what's going on is the muscles that are controlled by these nerves are breaking down. They aren't working as well. You're not moving as well as you used to, and you start to develop osteoarthritis or degenerative disc disease of the
Yeah.
spine as well.
Right.
That's a lot of what I see. That's when I see a chronic MS patient with pain, it'll be usually osteoarthritis of the spine or degenerative disc of the spine or facet joint syndrome, and they progress a lot quicker than an average person who doesn't have MS. We
Okay.
see a lot of that. I actually, and it's tough to treat because one of the best treatments for that
Mm-hmm.
is physical therapy and getting people moving. Well, a lot of people, if
Yes.
they can't ambulate as well, it's harder for them.
Yes.
But I always still do as much physical therapy as you can. It's great for MS. It's great for osteoarthritis. So try. But it's harder. It's harder to treat
Yeah.
those patients sometimes.
Patience is a key, actually. You have to be patient to see the results
Yeah,
and keep trying it.
exactly.
Yeah.
Exactly. I think a lot of patients, this is across the whole board, want a magic bullet from me. And I kind of tell them, I'm like, you're the magic bullet. I can get you to where you're decreased in pain, but you're the one that's going to keep that away. If I keep
Absolutely.
moving, they always say, oh, can you just give me a pill? Can you just make the pain go away? And, you know, that's not really the right
That's an easy
answer. In
way out.
MS, yeah, in MS, there are a lot of symptoms we can help with some anticonvulsives, antidepressants that have been reutilized for nerve pain.
Mhm.
And they help. They just help. They're not the answer. They help you do the things you need to do to
Yeah.
keep moving.
Probably if you start taking pills, I believe you get addicted to it. So whenever you have pain, just pop one pill and you are like, oh, I'm fine. And the other time you repeat the same process and becomes a habit eventually. And then your determination of trying and getting rid of something really goes away. It subsides.
Yeah,
Yeah.
exactly. I mean, I have a lot of patients that come in and say, hey, just give me opioids. And I don't give out any, you know, unless you have a broken bone, like a broken leg. I don't give it out because in the long term, it's hurting you. You
Absolutely.
might feel good when you take that pill, but in the long term, it's not helping you. It's hurting you.
Okay. Okay, doctor, let's start reading the comments and the questions we have received. So first question I can see is from Dexter Love 629, and she has written, I have MS since 2008, and now in past 4 months my scoliosis has progressed rapidly. Why?
Yeah.
Can barely walk now. I'm only 55 and now my spine is crooked. I'm in severe chronic pain every day.
Yeah. So we do see this with scoliosis. I'm glad someone brought this up. Unfortunately, it is affecting them. Um, Scoliosis is very dependent on your muscles being strong and keeping the spine from the curvature from getting worse. I actually work very closely with Dr. Ashgar, a scoliosis specialist down here. So we see a lot of scoliosis patients. Well, when you
Okay.
start to get MS, the muscles aren't firing the way they should because the nerves aren't controlling them as well. You start to get muscle spasms, you start to get spasticity. Well, if you think of it just mechanically, you know, here's your spine. Well, if you already have a curve a little bit, and then one of these muscles starts to spasm, it's going to really pull the curve the
Oh,
other way. Um, so it's a combination of spasms and weakness that can cause someone that's had, maybe they've had this curve since they were a child and it hasn't progressed at all. Well, once you get diagnosed with MS, now your muscles aren't doing what they're supposed to. So it can actually end up progressing further. And this can cause severe chronic pain in the back, especially if they're increasing by 5, 10 degrees per year, something along those lines. I've seen, you know, that's a little extreme, but I have seen it that far. And it is severely painful because there's a lot of nerves there that are coming out of our spine. I wish I had a model
yeah.
with me, but everyone kind of knows
Yeah.
what it looks like. Well, you can start pressing on those nerves. You can start pressing on those facet joints, which are called deep back aches. And sometimes it does need to be corrected with a scoliosis surgery. And the nice thing about that is once the scoliosis surgery corrects it, you have a good framework there that'll keep it from going. The problem is you still can have pain because you're still having the spasms in the muscles.
Oh,
So
okay.
this is why I work so closely with the surgeons, and they like working so closely with me, is they can do a great scoliosis surgery, but the patient may still have pain if they have something underlying like MS because they're still having spasms. So I need to treat the spasms. And if
Right.
they're localized spasms, we could treat them, massage. You know, we always start as conservative as we can, massage,
Hmm.
deep muscle rubs, that kind of stuff. We can do Botox in just the one area. But if it's spasms all over, we will prescribe a medication such as baclofen or tizanidine. But if you just go to a scoliosis surgeon and they're not really treating the whole picture, they might
Yeah.
do a beautiful surgery and help you, but you might not get out of your pain. So what is the, you know, our goal is to get people out of pain. That's
Yes.
and get you actually not even out of pain. I hate the pain score 1 to 10. What I care about is, can you do what you love? You want to cook? Can you cook? You want to golf? Can you golf? You want to play with your grandchildren? Can you do that? That's what I care about. I don't, if you're, some people can do that with 8 out of 10 pain. Some people can do it with 2 out of 10 pain. So I just need to know what you want to do, and then we'll
Yeah.
get you there together as a team.
So I can say here the key is finding the right doctor. It's not just a surgeon, but also who cares that you're back to your normal life again by treating the
Yeah, you
other
really need
spasm
to,
and the other problems.
exactly. You really need to find the right team. And we tell every patient that comes in, once they're here, they're a part of that team. It's not doctor telling the patient what to do. You're right with us in this fight to get rid of your pain, get you back to going. And we have a very good team here. We have neurologists we work with. We have rheumatologists we work with. We have, you know, obviously the spine surgeons we work with, and the pain side of things. And we all work together. We're always talking. There's nothing
Okay.
that's missed. And that's really how medicine needs to be done. Unfortunately, we all ultra specialize now, and we kind of put on those blinders and just see, if I just saw pain, 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 yeah, I could get rid of your pain, but I might not be doing you any benefit with your life.
Right. So, for all the people watching us, if any kind of pain and any kind of problems, please contact Dr. Anthony. He's based in Florida,
Thank you.
and he will definitely help you out with your pain and your issues. Okay, that's
100%. And the nice thing now about maybe the only silver lining with all this coronavirus is we're doing a lot of telehealth. So you don't have to come here to Fort Lauderdale to have
oh,
a conversation. If we're going to do a procedure, you know, I can't do
that's
that to the
wonderful. So people who
computer.
are not even
But
based in Florida, they can also call you.
yeah, they can call us. We use Zoom, you know, that platform to see patients. It's harder to do a physical exam when I can't get my hands on them,
Of
but
course.
it's better than nothing. At least I can, and you can upload, if you have an MRI of something or some x-rays, you can upload that to our system and I can look at it, share the screen, we can go over it together, all that stuff. You can tell me your whole history about what's going on, and I can at least give you a second opinion on what's going on so you can feel a little more comfortable.
Absolutely. Thank you, doctor. I'm sure many of you them
Yeah.
will definitely contact you. So,
Yeah.
moving on to the next question by Adila Terry. She has written how to avoid these pains. I think you've already answered this question. So, I'm going to move ahead. Quickly,
Okay.
Tina has written many lesions in my spine. Feels like electric shock pain. Yes, I hate that symptom. What do you have to say
Yeah.
about that?
So, you know, there's different ways to treat the electric shock pain. That's actually Lermet's sign, right? It's one of the signs of diagnosing MS.
So, doctor,
Um,
if I have to ask, what's the percentage like? How many of them actually complain about this symptom?
the electric shock pain is not everyone, but when you have it, it continues. But what do we do for it? That's what's more important. I'd say about
Yes.
50%. If I had to put a number on it, 50-60% of people tell me this electric shock pain. And there's different types of the electric shock pain. There's it's going into my arm and that's it, or it's coming around my chest, or it's all the way down my body. And
Yes.
that's a little tougher. With the electric shock pain, a lot of what we do is try to stabilize the nerves. Okay, the nerves are unhappy. They're getting demyelinated. The myelin is the protection around the nerve. They're
Right.
getting demyelinated. There's some scars forming, and those nerves are unhappy. So how do we stabilize a nerve? Well, the best way to do that is to basically tell the nerve, hey, we understand you're injured, but it's okay. Start with some kind of physical therapy, some kind of, to keep those nerves moving, let them know they're still working. Give them feedback. One thing is called desensitization techniques. Let's say it's just your hand that's getting those electric shocks. You can use like a lidocaine cream or a capsaicin cream where you can rub on it and you desensitize those nerves. Basically, you're just telling those nerves, hey, I get it. You're hurting, but it's not that bad. And don't keep telling us you're hurting. That's the whole point of nerves, is to tell you you're hurting, right? If you have a nail in your toe, it needs to tell your brain that you have pain. Well, if that nail isn't actually going to kill you, then you don't need to know that you have pain. So yeah, we can remove the nail, or we can just stop the pain. So that's desensitization techniques. Paraffin baths, a lot of people use those, and they're really nice because you can get a paraffin bath set up right off of Amazon where you dip your hands in wax, take them out. People like them. I mean, I've actually, my one patient, her husband uses them, and he doesn't have MS. He just likes the way it feels on his feet and on his hands. And then after that, he just enjoys it. So it's something that's nice too. If desensitization isn't working, then I usually jump to a low medication with low side effects. Something like gabapentin or amitriptyline are my first line that I use. They work really well. The side effects are usually drowsiness, and some people love that because they take it at night and they're having trouble sleeping. So if I can use a side effect to our advantage, that's always good. And then if it's very, very severe, the next step would be to do some type of procedure. We can do something like a sympathetic block, where we're blocking some of the nerves with some lidocaine or marcaine and a little bit of steroid, or even more after I've seen some patients that require a spinal cord stimulator. And what that is we put stimulation, we put lead wires into your spine that actually kind of give a pulse into the spine and control them. That's the most extreme. But like I say, we usually have the answer. And I tell a lot of patients there's a light at the end of the tunnel. We just don't know what tunnel we're going to take yet, but we will get you better. And we're going to try the least invasive thing first, always. And there's no magic bullet, though, too. We're going to keep trying. We're going to keep going. We're going to get you the right people. We're going to make you feel better. But that electric shock thing, it is very tough to treat because it's your central nervous system telling you I'm in pain. And it's hard to we basically have to trick the spinal cord into saying, hey, it's not that bad. But we're able to do that.
I remember, when I got this symptom, and this was my first symptom, which I got, and it was like, I was shocked. I didn't know what's happening to my body. The moment I used to, burst out laughing, and I used to raise my head little up also. I used to feel an electric current just passed from my head to my toe. And I was like, what just happened? It used to be really scary. I felt like I was a electric pole, the moving live electric pole, and I could not even.
You feel like you just touched an electric wire. Yeah.
I was bad. But then
have you been able to control it?
Pardon?
Have you been able to control it?
So that was my first symptom, like I said, and after that, of course, I went to my MRIs and my spinal tap, and then, of course, I took the steroids, and then it became fun.
Steroids are very good at decreasing all symptoms, so that's very good. One thing I do want to mention is a lot of times when patients get those symptoms, we will get an MRI of the neck to make sure it's not compression on the neck. One thing that was always drilled in my head when I was training is, just because someone has a disease like MS doesn't mean they can't have other pathologies too. So we always want to check, make sure they don't have, some kind of cervical stenosis or something along those lines too. So we are always looking. It could be X, it could be Y, it could be Z. We're going to figure it out.
Yeah. All right. Okay, doctor. Moving on to the next question by Ms. Karnina Crossent. She has written, I have had MS since 2006. I am now having problems walking, balance, and swelling in my feet. Okay.
The swelling could be, the walking and the balance, the number one thing she could do is get with a therapist.
Yes.
I think that's the biggest fight we have with MS is keeping people ambulatory, right? Keeping people moving. One of the best ways to do that is to aquatherapy, because you kind of get the desensitization there too. The one thing people need to realize with MS too, and I think most of you do that have it, is a lot of the aquatherapy places heat up their pools. That's actually not good for, maybe the only patient it's not good for is an MS patient, because as the heat goes up, the fatigue goes up, and the pain and fatigue actually gets worse. So you want to find a good aquatherapy place that has dealt with PT patients before. And I think that's a lifelong therapy. People sometimes think it's PT to fix. This is to maintain. maintain the strength you have, maintain the balance you have. Find the right DME, the right medical device that you need to help you, if it's a cane, if it's a crutch, if it's a walker, because the last thing we want is you to hurt yourself more by falling, by tripping over a rug or something along those lines. You know, I have a lot of patients that say, I'm never going to use a cane, I'm never going to use a walker. It's not a defeat to use something like that at all. It's to prevent you from
it's just a
having
stigma.
a
I think
major
the social stigma and also the self-confidence. Maybe
100%, and I totally understand that. And that's why I always say, find a good therapist that you can work with, and that person's going to be a part of your life for the rest of your life. If you're slowly declining in your weakness and your balance, you need to find someone that you're going to maintain. Your goal is to maintain. You don't need to run a marathon. We just want to keep you moving, keep you doing what you love. So that's for the balance and the weakness. And I think aqua therapy is great because it takes some of the pressure off your muscles with the buoyancy. But so I think that's great. If you can't find aqua therapy, regular therapy is good. Keep your muscles stretching. You don't want to end up getting spasticity. You don't want to end up getting muscle spasms. So get someone that's good at stretching your muscles, works one-on-one, keeps you moving, and keeps your balance. The swelling in the feet, it could be for a few reasons. It could be inactivity, since they are having a little bit of balance issues when you sit more, when you lay down more. So it might just be an issue where we can raise those feet up when you're sitting, try to keep them, you know, when you're lying down, put a few pillows under them. See, and then it also could be that your muscles in your legs aren't as compliant. So a lot of our blood pressure, a lot of what keeps our blood flowing, yes, it's our veins and our artery muscles, but it's also the muscles in our leg. As we walk around and move, they contract. And when they contract, they actually contract the blood that are inside of them and keep it moving. So that's one thing where if you have someone else stretching out your muscles in your legs, your hamstrings, your quads, you can help decrease that swelling. Another thing you can do for the swelling is either where they have those boots that do the pneumatic boots, or just even wrap it with ace bandage is a simple at-home thing you can do. Because you really don't want to start getting swelling and pooling. You're going to end up with other issues down the line. So, but if you get a really good therapist that's worked with MS patients before, they should be able to manage all of that for you.
Getting the right therapist who understands MS is very important, of course.
Extremely important. They're going to be a part. They're a part of your family now.
Yes. So, okay, moving into the next question, which I also agree, you know, the sedentary lifestyle from the pandemic has aggravated all chronic arthritis. Actually, it's happening with everyone because of the lockdown and because people are not able to move much, go out. Everybody is complaining of fatigue, insomnia, pain, and other kinds of issues, even balance issues for that matter. It's all cropping up now.
Yeah. No, 100%. So it's tough. I mean, this is across the board with chronic pain right now.
Yeah, we don't have a choice, but we have to be inside. But yes, we have to.
I mean, it's one of those things where there's no playbook for this. No one expected.
Yeah.
I mean, what I've always said is keep moving, keep moving, keep moving. Well, you know, a lot of people, especially here in Florida, may be stuck in their condo and their pool's closed. And what are they supposed to just pace around their house? You know, it's something that it's been really difficult. And I try to get people to what they do is they'll watch the videos online and do little exercises with the people online. So it feels like you're getting some interaction. So that'll help with the mental component.
I really like the online sessions of exercises and yoga, because everybody is not self-motivated to exercise or move around.
Exactly.
But if you actually enroll yourself with some kind of group, you actually do it. It motivates you.
100%. And then the other big thing I've been telling people is make a schedule. You know, we do better with schedules. Just because all of a sudden we're all stuck inside doesn't mean you're not going to have a schedule for your day. So make a schedule. Put your workout or your exercise at a certain time every day, twice a day is what I like to tell patients. You know, do something you enjoy at some point during the day, read a book at this time of day, set out your meals. Because the other thing that's happening that I think is increasing our pain is we're just kind of grazing through our house with food. We go to the cabinet, we go to the fridge, and we're just grazing. I still want people to set aside, 3 meals a day with some snacks in between, know what you're going to eat healthy. I think that's one of the big things we can do right now is still try to maintain some kind of anti-inflammatory diet. Don't
Yeah.
just go for the chips. Don't just
Usually
go
what
for the
people do
sugar.
is when they're bored, they go and grab something, some junk
Yeah.
food and have it. Yeah. That's a
Yeah, so
tendency.
it's tough. What's worked for my patients is the online courses, and the other big thing is making a schedule. Make a schedule and try to stick to it. It's been tough. Even people that have jobs are working from home, so their
Yeah.
schedule isn't the same. It used to be get up, shower, get breakfast, go to work, do work, have lunch. We used to have good schedules. Now it's
Yes.
get up, get on the Zoom, answer some calls, go get a bag of chips, drink a soda, so it's a new norm, unfortunately, for right now. Hopefully we get past this, but you have to keep moving and you have to keep a schedule, or else it can you can snowball out of control fast.
Yes, exactly. I just think, it will be like 10, 20 years later, when we sit with our kids and the grandkids, we'll tell them the stories of how we
I'm
lost ourselves
hoping,
in the house. It's going to be fun
I'm
then.
hoping, I'm hoping it's sooner than later. I'm hoping by 2021 this is all in the past. I don't know, you know, it's tough. It's very, very tough, and there's a lot of people out there that I
Yes.
think one thing we're going to look back on is the mental health aspect of what's been
Oh,
going on.
yes.
Depression, anxiety. A lot of people are alone, and their networks have been cut off from them. And I think that's something that we need to face head on right now, because it can be an issue for sure.
Yes, that is one of the most faced problems nowadays with coronavirus. And people are getting depressed, staying alone, or even if they are with others, they are so frustrated staying at home that they usually complain or fight or some things happen.
Yeah.
So keep your
Well,
mind
that's what
focused. A
happens.
schedule is the best thing in that. Yeah.
Exactly. No,
When you're
exactly. I think it
busy.
helps.
Yes, absolutely. Okay, moving on to the next question. We have a question by Shiv_8569. She's written, I was diagnosed in 2014 and have been in pain in my right arm for years now. So is this kind of pain permanent, doctor? Like if someone is complaining of pain, does it become a part of your life forever? Or, such pains can
It
also be
can.
treated.
If it's just located to one area, I would really look into what is causing that. If it is MS, just straight, you have a plaque lesion that's interfering with those nerves that are going to the right arm, then that's something you're going to be battling for a long time. Hopefully you exercise that arm can make it feel better. You're not developing spasticity in that arm. But a lot of times we do see that where like my MS pain is just in my right hand,
Yes.
and patients know that, and sometimes they'll wear a glove on that hand or something, keep it how they want it. A lot of people know exactly if I do this, if I do that, you kind of learn your pain.
Yeah.
Then there's the whole aspect of living with pain. We do have a good psychiatrist that we send to, and it's not because I bring up psychiatrists, and I think there's still a stigma, just like a cane. People think, oh, I'm not crazy. No. I'm like, I'm not saying you're crazy. I'm saying, how do we cope with the pain we have?
Yeah.
And that's a process. And I have a very good psychiatrist who talks people through that, saying, okay, we're at the point where we realize you're going to have some pain. So how do we manage this? How do we deal with this for the rest of your life? How do we not let it control you? You control it.
Absolutely.
It's a part of you now. And I got the idea with MS pain from I took care of a lot of amputee patients up in New York when I was up there, and you lose your leg, it's not coming back. So how do you cope with that? How do you deal with that? And that's something that has really helped patients. It's really funny to me because I'll see a patient 3 months later, and I'll ask them what their pain is, and they say it's the same. I'm like, well, you look so much better. They're like, yeah, but I can deal with it now. Or I'm able to understand it. I think half of humans is just wanting to understand what's going on to them and know what's happening.
Right.
That's easy to say. And then there's pain that's just absolutely tearing, and you can't just turn your mind on and deal with it. But that's when I would usually go to some type of medication, steroid, give a steroid boost every now and then, and then the interferons even. There's a lot of new medications coming out for MS that are hopefully, in good trials, that are targeting this kind of pain, and hopefully we can shut down that inflammation of the nerve, which will shut down that pain. If we can just turn those nerves off, it's hard. It's
Yeah.
hard, but that's the whole concept behind it.
Right. Okay, doctor, I have another question by Scorpio, and she has written, what about medical marijuana? Are you guys in any ways, prescribing or to your
So
patients, or how does it work?
yeah, so medical marijuana in Florida right now is approved. I was a prescriber, and then we
Okay.
merged with a larger company, and I can't prescribe because they're a nationwide company now. I do use it for my patients, especially with nerve pain. They do very well. So what I do now, I was a prescriber. Now I have a friend that's down the road that's a prescriber. So if I have my patients that need it, I send them to him. They get the card from the state. It's a very streamlined process. It works pretty well. They get their license, just like a driver's license from the state, and they go try that. The problem with medical marijuana is it's a trial. We don't have like, hey, there is some like this is for this is for nerve pain,
Yeah,
this is for back pain, this will help you sleep, this will help for anxiety, but everyone's different.
of course.
So it's a very much a trial and error thing where I tell patients, try this. If that doesn't help, try this. If that doesn't help, try this. And then in the end, I tell them what I've seen, and this is just from my own experience with my patients, is 50% of patients love it, swear by it, it's done great for them. 50% of patients, it's done nothing. But you're not doing any harm. So it's worth a try. It's definitely worth a try. Along with medical THC, there's also CBD. And
Yes.
CBD is anti-inflammatory. We know that. So once again, inflammation is going to come up 100 times in this conversation. Anything that's anti-inflammatory is worth a try. What I love about CBD is it decreases inflammation, it decreases pain, it decreases anxiety, and it helps sleep.
Yes.
Everyone with pain needs all four of those things. So I tell patients, take it at night. If you sleep better, your pain is better. That's a fact.
But
We
of
know if we
course,
decrease your anxiety, your pain is better. We know if we decrease your inflammation. So I have a lot of patients that the medical THC might make them feel weird. They might get that high from it that they don't want. They don't really get that from the CBD. So I tell them to try the CBD. Especially they like the gummies, the little gummies they can just eat at night. I like them too because they sit in their stomach a little longer and it's a slower release. So it'll
okay.
keep people on a more even keel. But the CBD drops work as well. There's many different forms of all of it. But there
But
is
it
a
also
place for it,
depends from person to
especially,
person if it affects someone or it doesn't affect someone, or it's helpful for
yeah.
everyone.
But I would 100% say try it if it's legal in your area. I'm not
Okay.
advocating illegal use, but hopefully medically it'll be used throughout soon. But
Yeah. So usually what
yeah.
happens is I think there are some certified doctors who prescribe CBD or something, and people who are watching, please ask your doctor before checking anything. Okay, and
Yeah.
moving to the other question by Misha Bear, she's written, got diagnosed with MS 20 years ago, and have L4-5 herniated discs. I get facet injections to help and not giving me effective relief. Huge on PT and moving to help muscles. And is there anything you could suggest?
So the facet joint is just part of the spine. Axial back pain can be from the muscles, the facet joint, the disc. There's a good chance that if the facet joints aren't helping, that's not where her pain generator is. Her or his, I don't know who it was. It's one of the things where you really need a good spine doctor to look at your MRI, do a really good physical exam to find that pain generator. Because what I tell people is the procedure, the injection we do, let's say, is part of the diagnostic process. So if I do a facet injection and it doesn't work, it stinks it doesn't work, but now we know that's not where the pain's coming from. It could be the SI joint, the sacroiliac joint lower. It most likely is the disc in front. It could be a little bit of stenosis on the nerves, compressing the nerves. So if the facet joint injections aren't helping, then it's likely coming from another area. If you have degeneration in the spine, and there always is a group of patients where injections don't help and you need a surgical evaluation where they can stabilize that area. If you stabilize a joint, the pain will go away. It's just surgery, is a bigger deal. So we try not to do it if we don't have to, but we have the best spine surgeons here. People always laugh at me when I say that. I say, yeah, we try not to do spine surgery, and I work with two great spine surgeons. But we do, because we know how big of a deal spine surgery is. But if it is axial, mid, lower back pain, we could definitely figure it out if we took a look at the MRI. It just might take some time. And don't get discouraged if a shot doesn't help, because that is giving the doctor and giving yourself information that that's not where your pain generator is. You just got to find where the pain's coming from. Once you do, then we'll have options to fix it.
Okay. So the next question, doctor, is by Daniel Kennedy, and she's written, what type of massage therapy is the best?
That's tough. I would say I like isolated muscle massage. For patients with MS, I would say isolated muscle massage where you're having spasms is best. Kind of a deep tissue massage sometimes can make things worse. If you get really deep into a muscle spasm, you can cause a lot of pain during it. But it could help in the long run, but it could be very painful. That's one thing I tell my patients. It's like, hey, you can try this, but it might be very painful when you do it. I kind of leave it up to the massage therapist a lot of times. Massage is one of those things where whatever works best for you, keep maintaining that. I like isolated muscle massages though, where we know, let's say your traps are very tender, and that's where your trigger points are occurring, or your paraspinals are very tender, and that's where that's occurring. So I would like to isolate in those areas and really work those out, and then work from there, because everything's connected. So let's say your traps, are your problem. You start there, work from there, work up into the occipital area, work down into the shoulder muscle, loosen everything up. The point of massage is to loosen things up, right? And that'll decrease the pain in the long run. But massage therapy is tougher to say, hey, this is gonna work for you. It's really a try it if you like it, if you can handle it too, because deep tissue massage is good, but it can hurt a lot.
Yeah, so it depends from person to person. For example, when I go for any kind of massage, I do not like deep tissue. I feel it hurts me. I like the soft massage. I cannot go for a deep tissue one. So it depends from person to person. I can 100%. See some. Yeah, sorry. Go on, doctor, please.
No. I agree 100%. Massage is very much whatever helps you. If it helps, do it. But it may be hard to tolerate. I don't think people realize massage can hurt a lot, and it can be painful for a few days afterwards too. You really have to hydrate after massage. You have to drink a lot of water, maintain your strength in those areas too. Yeah. But most good massage therapists will go over all that with you. Most good massage therapists will go over all that. You tell them what you have going on. You tell them where it hurts. They should be able to diagnose, isolate, and do all that.
Right. So I can see 321 Paul has written, do you guys see patients that have had previous Sclerosis surgery? I think doctors already answered. They do see, and I can see a lot of messages rolling with your website address. Maybe they want to contact you. Great.
What's that?
Okay.
So I can't see the questions as well as you. There we go. So they were saying that someone had previous, how can I see you? I'm seeing Dr. Ashkar next week for surgery evaluation. If you're seeing Dr. Is that the one that just said it? Dexter Love? If that person's seeing Dr. Ashkar, I'll probably be here at the same time. And Dr. Ashkar works very closely with me. If you don't need surgery, he will send you to me. That's how we work. We talk all the time. So that'll work out perfectly.
So it'll be safe hands. Okay. So going to next question by Dexter Love 609. She's written, as a footnote, thanks for taking my question, but wish I could keep moving, but I can't after a dog walk. My back spasms and right hip goes up in the air and I'm completely crooked. Can't cook. How can we get that?
So I think that's the same person that's coming to see Dr. Ashkar. When you get to that point, my answer would be come see one of us. Well, we need to get more imaging, see what's going on, get a nice X-ray of that spine, see how the curvature is changing, possibly get an MRI. It sounds like you're getting muscle spasms. It sounds like maybe some trigger points could help, maybe some massage in that area could help. I'm guessing. I'd have to see your. But this is what happens. It's a great example actually. It's a patient that says, I'm no longer able to walk my dog, right? So in my mind, I say, all right, how do I get her back to walking her dog?
Yes,
I
absolutely.
need to figure out what's wrong, and then we have to figure out how to fix it in the easiest and least invasive manner. So that's where we kind of use everything we know to go about to try to fix that.
Right.
So if they're coming in to see Dr. Askar, that's a great place to start. He will give you, he is the guy for scoliosis. He is the guy. He will tell you everything you need to know. He will go over everything. He will let you know if you need surgery or do not. Even if you don't need surgery, he'll tell you what would happen if you did. He's the scoliosis guy. If you don't need surgery, he'll probably get you to me, and then we'll start working together to decrease your pain and get you moving and grooving. Yep.
That gives a lot of confidence. Thank you.
Yep.
I can see a question by Quiglitina, and she's written the hugs that won't end. I have taken 3 classes and I'm doing all things I should, but the hugs continue to be longer and more painful. And she's talking about MS hugs.
The hugs. Yeah. So MS hug is one of the one question I would like to ask is has she tried any medication for it yet?
Mm.
So everything, I mean, she's probably doing everything. Warm compress when they come on. Drink plenty of water. Eat a super healthy diet. I mean, super anti-inflammatory diet.
Yes,
Red
I can
meat.
see
I
few
wouldn't.
people are also talking about the diet. So that was
Yeah,
anyways my
yeah.
next question.
Super healthy diet. When you start getting the MS hugs, that's your body telling you the muscles aren't happy because the nerves aren't happy. Muscles are dumb. I say that all the time. Without the nerves telling the muscle what to do, they don't know what to do, and they usually tighten up.
Right.
So you start getting this feeling, and usually the MS hug, it can happen almost anywhere from the neck to the lumbar. Usually it's around the chest.
Yes.
Hopefully it only lasts a few minutes. I mean, sometimes it can last, I've even heard hours. But the stuff you can do that she's saying she's already doing, but for other people that may not know. Warm compress to the area when it starts to hurt. Drink plenty of water throughout the day. Stay hydrated. Super healthy diet. And I work very closely with a nutritionist that we send patients to all the time. But my dumbed down version of the healthy diet is decreasing the inflammatory things. White flour, processed sugars, red meat, alcohol, and smoking. I mean, smoking, I don't say do none of the other four. Smoking, definitely, there's no reason. Cut down, though, on your alcohol. Cut down on your red meat. Cut down on your white flour. And cut down on your processed sugars. High fiber, because the fiber and protein will keep you full. A lot of leafy green vegetables, a lot of chicken, fish, that kind of stuff will help. And it's it's tough to do, but people that do it really start feeling better. Massage will help the MS hug area. Kind of even a light massage in your intercostal muscles, in your back muscles of the area. The other big thing people don't realize is they get worse if you're not sleeping well. So you really need to try to get 6, 8 hours of sleep, uninterrupted sleep. That's one thing where you're making a schedule. You're becoming someone that at 9 o'clock I put down my phone. At 9:30 I do this. At 10 o'clock I'm in bed. I'm going to bed, and I'm not waking up till 6, 7 o'clock. You have to make a sleep schedule and keep a sleep diary of what's working and what's not working. When the hug comes on, one way to release it sometimes is deep breathing. So a lot of people get nervous, they get anxious, understandably. They start taking shallow, short breaths. People even tell me sometimes they feel like they're having a panic attack, anxiety, or a heart attack even. That's one thing that we always tell our patients is always see a cardiologist. Make sure it's not your heart. Like I said, you can always have other problems even though you have one disease. But when you have the hug symptoms come on, really deep breaths in and out. Really try to meditate, I tell people too.
Yes.
And then it's tough to really make it go away when it's happening. Then once you've had it, talk to your doctor, and that's where if you start having it more often and they're lasting longer, try different medications. I know I like Cymbalta. Lyrica's pretty good, and gabapentin. I like Cymbalta a lot because it also decreases pain.
Okay.
And it's anti-anxiety. I tell a lot of people Cymbalta is a good one to use. But the MS hug is tough. It's very tough, and it's. I feel for the patients that have it, because I've seen a patient have it right in front of me in my office, and you feel kind of helpless sometimes. But these are the things you can do. That's what we have right now, and those are the best things you can do for right now.
Okay. Okay, thanks, Doctor. Doctor, we have crossed 35, 40 minutes, and I think we should just try to run up ASAP. I have a few questions I got beforehand, before joining the session in my private DM
Yeah,
for you.
yeah,
So I'm
perfect. Let me
gonna
just
place
drink
those
water.
questions first. Um, so my first question was given to me by, 1 second, Abbas Yofi, and she has written that my legs are numb, and one of my leg is feels very irritated, kinds of heavy and short. I take Delphira pills, and if I don't take them, I get very uneasy. There's some pills that
She
she's
takes
very
what? She
used to.
takes what does she take?
She's from Dalfira pills. She's from Iran, actually.
Okay.
So yeah, so
Is
there's
that is
something
that a
that
muscle?
she feels her
Is that a muscle
legs.
relaxant or an anti-inflammatory? I don't recognize that
I'm not
pill.
sure of that. She hasn't
Okay.
mentioned.
I'm guessing it's an anti-inflammatory of sorts or a muscle relaxant, maybe a pain reliever. So she's basically having numbness in both legs and heaviness in one leg.
Yes. No, it's a
So
no, it's just in the left leg.
just in the left leg, they're
Left leg, and
having,
the leg feels very heavy as well.
okay, not shooting pain though. It doesn't sound like. It's mostly just heaviness. And that's the progression that we see a lot. The best thing she can do is try to keep moving that leg because you don't want to develop spasticity or spasms. And if you do, you can do some bracing or some Botox or massage in that area. The heaviness, though, is tough to treat. That's really the progression of the disease a little bit.
Okay.
To me, the best thing you can do though is maintain your good leg, and then if you have to, use a crutch on the other leg.
Okay, but if I have to say, keep moving, physiotherapy is the answer.
Yeah,
Mainly for,
exactly.
yeah, you have to
Therapy,
be
100%,
active.
and maintain your ambulate. That's what I was trying to say. Yeah, like don't just because one leg isn't doing it. You have your other leg. You have ways to keep moving without even that leg working at all. So if it's painful, there's ways to treat the pain. The heaviness, you want to keep that leg moving too. You want people to stretch you out. You don't want to develop
Right,
spasms. If that
right.
leg is sedentary, those muscles are all going to tighten up, and they're not going to work.
Yeah. Okay. So
Therapy is the best thing for you.
right. So the other question I have from Isa, and she has written, why does a regular infection of any kind trigger my MS symptoms, which come with a lot of pain? My pain is in my legs, varies from deep ache, tingling, fire ants, spasm, very cold feet and legs, and massive
Mhm.
fatigue. Also can affect my walking and balance.
Yeah. So a lot of patients will tell me that they know when they have a UTI just because their MS symptoms get worse. It,
Right.
it's it, it, it's what I've been saying the whole time. It's the inflammation game. So when you get an infection,
Mm-hmm.
your body starts fighting that infection. Well, you don't just fight that infection. Let's say I have a hangnail that's infected. You don't just fight that infection there. It's a systemic response.
Mm.
So the amount of inflammatory response that you have in your body goes up totally. So the nerves that are already getting dinged because of the MS are starting to fire off. That's the problem. So the best way to treat that is to treat the infection as fast as you can. Antibiotics, if you need to have, I've seen it where just
It is
even a
true. So
little
whenever you have any other
ingrown hair.
problem, your MS triggers. So
Yeah,
keeping the
I've seen it where even an ingrown hair has caused an MS to flare up, and we couldn't figure out what it was. And it was just this little infected ingrown hair on someone's leg. Treated that, and the symptoms usually return to normal once you treat the infection. So the biggest thing is treat the infection, and the reason it happens is because of the inflammation. Your body's trying to fight the infection. Well, when your body's trying to fight an infection, you develop inflammation throughout everywhere.
okay. I have the other question, doctor. I'm not sure if the answer is going to be the same. I just want to read it out to you. She has written,
Mm-hmm.
I have an odd sensation for the last 2 days in my left leg. This is quite personal, and she's from Britain, and she has tingling sensation down my left leg, also in my genital area. It is not painful, but it is super weird. and it's kind of embarrassing, when she talks about the
Yeah,
tingling.
yeah, that's understandable. That's something where I would do a little more investigating. I would ask a
Um,
few more questions.
just one second. She has also mentioned that she also has sciatica at the age of 35. So
So
she's
that's
connecting to it.
what it sounds like to me, that it's a double hit syndrome, kind of where the nerves are already upset because of the MS, and then she's getting a little bit of sciatica on top of it. That's what I was going to say. So I would probably make sure the spine's okay. Take a look at the spine. Take a look at the nerves as they trace down. But it sounds like she's getting a little, especially when it's one-sided like that, shooting down. It sounds like she's compressing the nerve at some other area, and the nerve's already irritated. So
Is
when
it
an
can be
irritated
because of
nerve,
too much of stretching that she is doing or lots of running she's doing? Can exercises be
if
also a reason why it's happening?
it could be if she's overdoing it. I
Mhm.
always say let pain be your guide. Once you start having pain, shut it down. It's always tough for me to tell people to do less because I'm always trying to get people to do more, but you can overdo it.
You have to listen to your
To me,
body
it
as well.
sounds like,
Yeah.
yeah, to me, it sounds like it's probably a bout of sciatica. It's a tough one. That's one where I'd really have to see the patient, ask them exactly what makes it worse, what makes it better, how long has it been
Mhm.
going on, and try to tease apart what it is. Because the genital area too could be a little bit different. Where that sounds more, that could be just straight some MS pain coming to that region. Where we can help with that too. That's somewhere where a stimulator may come into effect for her, or something along those lines, or a sympathetic block. It sounds like just overactive nerves. One, because of MS. Two, because of possibly
Right.
sciatic type
Yeah.
picture. It sounds like the nerve's getting hit twice, though. That's what it sounds like to me.
Right.
But
Thank you, doctor.
that's when we have to get an MRI or do something along those lines.
All
Yeah,
right. Thank you, doctor. Thank you so much for your time. We have crossed for 5 minutes now. I'm sorry for
it's
that.
okay. It's great.
But before going, I want you to, address to everybody listening to you right now, if they have to contact you, where they can contact you and how they can contact you.
Yeah, so the best way to contact us is through two ways. So either call our office. Our phone number is 954-567-1332. You can ask for
All right.
Dr. G. And like I said, we do telehealth. So just tell them you don't have to come here. Tell them you're doing telehealth. They'll get you to upload any images you have or any paperwork you have. We can upload that. The other way to really look into what we do and how we do it is to go to our website. And that's Cantor, Cantor, spine
Mm-hmm.
center.com. So cantorspinecenter.com. There's a lot on there. And then also follow me on Instagram, Facebook, Dr. G Sports Spine. We put a lot of stuff up here about what we do and how we do it. I think social media is a great way now for doctors and anyone to interact with their patients. It's really worked out well for us, and I enjoy it. I feel like it's a little less serious. We can talk about more things on a
Yes.
person to person level,
It's a
not a
personal.
doctor to patient level. I don't like that. I like seeing eye to eye, talking eye to eye, learning from everyone. So I think social media is really starting to evolve in that way, and it's really starting to help um, with getting in touch with patients and answering questions for patients. So yeah, hopefully, if you have pain out there, we can help you. We will try our best. That's all I can tell you. We have a great group of people here, a great network of doctors around us, and this is what we do. We get you back to doing what you love. So that's always my goal, and that's what I strive for.
All right. Thank you, doctor. I'm really thankful for your time, your efforts, and thank you for the great advices that you have given to everybody tonight. I'm so sure I
Thank
can
you.
see everybody's just loving it. Look at the hearts flowing.
Yeah, that's awesome. No, thank you so much for having me, and keep in touch. Okay.
Sure, absolutely. I think we can sometime do it again whenever you are free.
Yeah.
Thank
No,
you
I
so
would love to.
much.
I would love to. Thank you very
Okay.
much.
Okay. Have a good day. Thank you. Bye.
Bye now.
Thanks. Okay, guys, thank you so much for being here. I know you loved the session. I can see, all the thanks flowing up and the hearts coming up. Thank you, everybody. So, Doctor has already given his contact number to you, how you can contact him. And if you've missed it, I'm going to put this on IGTV. So you can, rewind this and see the contact number again. You can, of course, go on his website. I think Jelly Legs has already put his, oh my gosh, she's too fast. She's put the Facebook link and the website link, everything, contact details of the doctor already here. So anyways, I'm gonna put that too for you to refer. And yeah, I'm sorry we could not answer a few questions. So last question came up was about, does MS patient can marry? Well, why not? I know I don't want to. I just want to know why not? Why can't MS patients marry? Of course, you can marry. You can have kids. You can do so many things with your life, and MS doesn't stop you from anything. Doctor also said that you have MS. MS doesn't have you. You have pain. Pain doesn't have you. So why to stop living your life? If you're getting married, you're actually gonna conceive kids, then please speak to your doctor. Just take advices from the doctor, what they have to tell to you about, conceiving, and what all precautions you have to do in terms of medications or diet or anything. So all I have to say that do not stop living your life because of MS. Please remember, you have MS, and MS doesn't have you, and you are strong. You have to be a strong warrior. Okay, guys, thank you so much. I'm gonna meet next week again with MS Warrior, sharing her brief story about how she has been living with MS since last 17 years. And the following week we'll be again meeting one of the doctors who will, speak to you about other issues. So we'll meet again. Thank you so much, and keep sharing the questions. I make a note of every question that you send to me and ask the doctors. Thank you. Have a good night. Bye.